Hey everyone, welcome back to another INBDE prep video. I'm Macy and today we're going to be doing some practice problems involving the 5 ethical principles that we've learned. Before we dive into the questions, let's do a quick review of the 5 fundamental principles discussed in the American Dental Association's Code of Ethics. The first principle is patient autonomy, which can be summed up as self-governance, or just having control or rule over yourself. The principle focuses on respecting patients' desires, letting patients be involved in choosing treatment, and patient privacy. Next up is non-maleficence, which stresses to do no harm. Some key unethical concepts that fall under this principle are personal impairment, patient abandonment, and personal patient relationships. Next is beneficence, the principle that means to do good. This principle encompasses the idea of improving community and public dental health, as well as recognizing and reporting abuse and neglect. Next, we have justice, which can be boiled down to an emphasis on fairness. This concerns treating every group of people without bias or prejudice and accommodating emergency patients. And finally, we have veracity, or the principle of truthfulness. This principle focuses on communicating truthfully not only to patients, but also to the public in advertisements and third parties like insurance. These 5 together are the ethical principles you should know about as a dentist and for your boards, and they're what our practice questions will be concerned with. Let's try some of those problems. Example number 1. After an emergency appointment, a dentist informs the patient to visit their primary dentist for comprehensive care. Which ethical principle was followed? A. Veracity, B. Patient autonomy, C. Non-maleficence, or D. Justice? Go ahead and pause it and think about this question. The correct answer would be D. Justice. Providing emergency care to a patient falls under the ethical principle of justice, and the principle states that if you do provide emergency care to a patient who is not on your record, you must return them to the primary provider after the emergency unless the patient says otherwise. This is fair to the regular primary dentist, as they do not lose their patient if not available during the time of the emergency. Some other topics that fall under the Code of Justice include treating people fairly with no prejudice, your testimony in judicial settings, and reporting faulty treatment by other dentists via justifiable criticism. Example number 2. Which of the following ethical principle is violated when a dentist does not report suspected child abuse? A. Non-maleficence, B. Beneficence, C. Veracity, or D. Patient autonomy? Now go ahead and pause it and think about this question. The correct answer here would be B, beneficence. It is our ethical responsibility and legal responsibility as a dentist to be acquainted with the signs of child abuse and to report it whenever it is suspected. This ethical responsibility falls under the principle of beneficence, or doing good for others and promoting their well-being. Failing to report suspected child abuse neglects the duty to protect the child and promote their welfare, thus violating this principle. A lot of people get confused on why mandatory reporting of abuse would not fall under option choice A, non-maleficence, or the principle of doing no harm. This is because we are not the ones inflicting harm in this abuse scenario. By stepping in and reporting signs of abuse, and hopefully preventing future abuse from occurring, we would be doing good, which falls under the ethical principle of beneficence. Example number 3. A patient with a history of substance abuse requests a prescription for hydrocodone, but the dentist denies the request. Which ethical principle is being applied? A. Non-maleficence, B. Beneficence, C. Veracity, or D. Patient autonomy? Go ahead and pause it and think about this question. Knowing that this patient has a history of substance abuse, it would be harmful to them to prescribe hydrocodone, especially because they are specifically requesting it. Because prescribing this controlled substance would be harmful, the ethical principle that would be breached would be A. Non-maleficence, which is entirely focused on doing no harm. This decision by the dentist to deny the request prioritizes the patient's well-being and safety, thus upholding the principle of non-maleficence. Example 4. A family complains about the high cost of a dental procedure. You suggest splitting it into 2 appointments for insurance coverage, even though it's meant to be done at 1. Which of the following ethical codes is being violated? A. Patient autonomy, B. Veracity, C. Beneficence, or D. Justice? Go ahead and pause it and think about it. The correct answer here would be B. What we are doing is unethical and deceptive, and therefore would be a violation of veracity, answer choice B. This ethical principle is focused on truthfulness and honesty, and by suggesting we split it into 2 appointments for the sole purpose of maximizing insurance coverage would not be fully transparent to the insurance company. The ethical principle of veracity emphasizes honesty not only to our patients, but to the public and third parties, like insurance, as well. Example number 5. What ethical principle involves the duty of a practitioner to respect a patient's right to self-governance? A. Veracity, B. Beneficence, C. Non-maleficence, or D. Patient autonomy? Once again, go ahead, pause it, and think about this question. This is a pretty straightforward question and is basically just providing the definition of D, the ethical principle of patient autonomy. This principle focuses on respecting a patient's self-governance, or just having control or rule over yourself. We can respect this right by allowing patients the ability to be involved in the treatment process, via telling them about all treatment options, as well as the benefits and the risks of each. Another huge part of patient autonomy not mentioned here is patient privacy, which concerns HIPAA and patient confidentiality. Example 6. Which ethical principle involves a dentist's obligation to improve community dental health and welfare? A. Patient autonomy, B. Beneficence, C. Justice, or D. Veracity? Go ahead and pause it and think about this question. We kind of touched on this concept in a previous question, and so the answer here would be B. Beneficence. Beneficence can be boiled down to doing good, and improving community dental health and the welfare of the public is a huge pillar of this ethical principle. Other important principles relating to beneficence include reporting abuse and neglect, as well as a positive demeanor in the workplace and to the profession. Example 7. Which ethical principle is violated when a dentist charges higher fees to patients with insurance? A. Non-maleficence, B. Beneficence, C. Veracity, or D. Justice? Go ahead and pause it and think about this question. The ethical principle being violated in this scenario is C. Veracity, which emphasizes truthfulness and honesty in all professional interactions. Overbilling, which involves increasing a fee solely because the patient is covered under a dental benefits plan, breaches the fee representation portion of this ethical principle. This practice is unethical as it entails deception and misrepresentation, undermines trust between the patient and the healthcare provider, and contradicts our commitment to providing honest and fair treatment to all patients. Example 8. Which ethical principle is violated by a dentist who stops treatment without informing the patient? A. Patient autonomy, B. Veracity, C. Non-maleficence, or D. Justice? Go ahead and pause it and think about this question. Stopping treatment without informing the patient can be very harmful and would therefore be violating C. the principle of non-maleficence, or do no harm. An important concept that falls under this ethical principle is patient abandonment, and it states that regardless of the reason the dentist is no longer providing future care to a patient, the dentist should not discontinue treatment without giving the patient proper notice and opportunity to obtain services elsewhere. Some other key topics that fall under non-maleficence include personal impairment, referrals, and keeping your education up to date. Example 9. Which ethical principle is being respected when a dentist informs a patient about the risks and disadvantages of removing a healthy, decay-free filling and the patient decides to proceed with the procedure? A. Veracity, B. Justice, C. Non-maleficence, or D. Patient autonomy? Go ahead and pause it and think about this question. We kind of touched on this in the previous question as well, but the ethical principle being respected in this case is D. Patient autonomy. The ethical principle of autonomy is respected when a patient is fully informed about the risks and disadvantages of a procedure and then makes an independent decision to proceed. This principle emphasizes the patient's right to make decisions about their own healthcare based on the information provided by their healthcare provider, which in this case is us, the dentist. This allows the patient to have self-governance or control to rule over themselves. Example 10. Which ethical principle requires a dentist to inform the third-party insurance that they will not be collecting the patient's copay? A. Non-maleficence, B. Beneficence, C. Veracity, or D. Patient autonomy? Go ahead and pause it and think about this one. The correct answer choice for this question is C. Veracity, and that is because the dentist is required to be truthful and let the insurance company know if they are not collecting the copay. Veracity is centered around truthfulness, and it emphasizes honest communication to not only our patients, but also to the public and insurance companies. By not informing the insurance company that the copay was not collected, overbilling would occur since the insurance company is under the impression that the patient is being charged and that the bill is higher than it actually was. This is an omission of the truth and is a breach in veracity. Example 11. Which ethical principle is primarily upheld by HIPAA's privacy regulations for protecting a patient's information? A. Beneficence, B. Patient autonomy, C. Non-maleficence, or D. Justice? Pause it and think about this question. Now, this is a great practice question because it is so important to know a lot about HIPAA, both for the boards and for when you begin to practice as a dentist. The ethical principle that is upheld by HIPAA's privacy regulations concerning patient information is B, patient autonomy. This principle is central to HIPAA regulations, as it ensures that patients have the right to make informed decisions about who can access their medical information and how it is used. This principle supports patients' independence and self-governance, as well as respecting their ability to manage their personal health data. Example 12. During an extraction treatment, a dentist accidentally fractures a root tip and leaves it behind, but does not inform the patient. Which ethical principle is being violated? A, non-maleficence, B, beneficence, C, veracity, or D, justice? Go ahead and pause it and think about this question. Now, this situation is very clearly an example of a dentist withholding the truth from a patient, and therefore the ethical principle being violated would be C, veracity. To reiterate, veracity refers to the ethical principle of truthfulness and honesty, and leaving a root tip behind without informing the patient is an unethical and deceptive act. The dentist in this scenario should be transparent with the patient and tell them what occurred. Example 13. If a patient is asked by a dentist to sign a contract agreeing to treatment without x-rays, which ethical principle is being violated? A, justice, B, non-maleficence, C, beneficence, or D, veracity? Go ahead and pause it and think about this question. It would be unethical and potentially harmful to the patient to agree to do treatment without getting x-rays, which makes the answer to the question B, non-maleficence, or the principle of doing no harm. Treating a patient without necessary diagnostic tools, such as x-rays, can lead to substandard care and possible harm. And by asking the patient to agree to treatment without x-rays, the dentist is not ensuring the highest standard of care, thus violating the principle of non-maleficence. Example 14. If a patient requests the lightest shade for their veneers, despite the dentist's advice that it may not match their complexion, and the dentist proceeds with the patient's choice, which ethical principle is being upheld? A, patient autonomy, B, justice, C, beneficence, or D, veracity? Go ahead and pause it and think about it. The ethical principle being upheld in this question is A, patient autonomy, which is all about respecting the patient's desires and preferences. It is our responsibility to the patient to provide our professional recommendation in a situation like this, describe the outcome, the risks and the benefits, but it is ultimately up to the patient to decide what care they would like done for themselves. Providing this shade of veneers to them that we disagree with won't cause any harm, so there is no actual risk to the patient if they choose this shade, even though we as the dentist would not aesthetically recommend it. By honoring the patient's request for the lightest shade veneers, despite advising otherwise, the dentist is upholding the principle of patient autonomy. Example 15. Which two ethical principles are in conflict with respect to community water fluoridation? A, beneficence and patient autonomy, B, beneficence and veracity, C, non-maleficence and justice, or D, justice and veracity? Go ahead and pause it and think about this one. This question is a little bit trickier because we have two ethical principles involved. But the correct answer here would be A, beneficence and patient autonomy. Beneficence is the principle of do good and is all about improving community dental health and public welfare. Water fluoridation is a great way to do this because it has been shown to reduce caries prevalence. Patient autonomy concerns self-governance and is all about patients being able to make decisions for their healthcare and be in control of the care they receive. Water fluoridation can violate this ethical principle because the public doesn't really get a say in their water being fluoridated. These two concepts of doing good and self-governance are in conflict when considering community water fluoridation. All right, everyone, that was the last question. I hope this was helpful as you are practicing applying the ethical principles. Good luck studying these principles and good luck on your board exams.